In this lesson, we're going to discuss trauma-related symptoms. So what are trauma-related symptoms? These symptoms can range from psychological to emotional symptoms, as well as physical and behavioral symptoms. Psychological symptoms can include nightmares, flashbacks or other intrusive memories, trouble concentrating or problems with your memory. Emotional symptoms can include hopelessness, anxiety or panic attacks, depression, shame, a heightened startled response, getting emotionally overwhelmed, or even feeling emotionally numb and disassociation. That's when you block yourself off from feeling anything. Physical symptoms can include headaches, stomach aches, and insomnia. Behavioral symptoms can include rage, self-destructive behaviors like cutting, eating disorders, substance abuse, and suicide attempts. In the exercise after this lesson, you will find self-reflection number 3, which contains a list of trauma-related symptoms. You'll choose some of those symptoms that you've been experiencing. There are also plenty of symptoms that aren't listed on the self-reflection sheet, so feel free to add things that you've experienced or you feel are your own symptoms. It could be understandable to think, why am I doing this? I don't even want to deal with this stuff. I don't want to think about these symptoms. But there are consequences to not managing your symptoms. The Substance Abuse and Mental Health Services Administration warns that if trauma is not addressed in treatment, individuals are likely to have poor recovery outcomes and are highly likely to have poor physical health outcomes as well. There are many studies that show the negative effects of trauma on our health. There's a direct correlation between trauma and physical health conditions. There is also a correlation between substance abuse and health conditions. On their own, addiction or trauma significantly increases the rates of diabetes, COPD, heart disease, cancer, and high blood pressure. When you have addiction and trauma history, the chances are even higher that you might suffer from one of these health issues. In self-reflection number 4 after this lesson, we're going to list 6 ways that managing your symptoms will be critical for your sobriety from addictive and other self-destructive behaviors. What would life be like if you weren't sidelined by these fears or symptoms? What kind of things would you be able to do that trauma has kept you from doing? This might be trying to stay healthy, maybe going to the gym. Maybe you haven't been able to go to the doctor because of trauma. There could be hobbies that you've given up, or people that you've given up on because of the trauma symptoms. Imagine the things that you won't have to worry about because your symptoms are under control. Add these things to your list as well. People avoid a lot of things because they have trauma symptoms. Some people might avoid parties or gatherings because of their anxiety. Some people might avoid doing important things to them like going to church because of shame. Other people might avoid driving anywhere because they're afraid of having a panic attack. These are the kind of things that we're going to put here. Symptoms have 3 basic components that interact with one another. First, there's the physical sensations. This could be anything from your heart pounding, sweaty, dizziness. Maybe you get shaky. Maybe you start to get tunnel vision and you feel like you're going to black out. The second is your thoughts, such as expecting something terrible to happen. These are those negative tapes that you play in your head and the negative things that you tell yourself. Then there's the behavioral responses. These are things like running away, avoiding places, or using substances. When we feel like we're in danger, the emotional and physical parts of our brains override the thinking parts. This is because these parts of the brain are only focused on survival, and they work a lot faster than the thinking part. As a result, we'll do anything that quickly relieves the discomfort of our symptoms. The problem is that the quick fix isn't always the intelligent choice because, well, we're not thinking so clearly. And if the quick fix works, it can easily become an unhealthy habit. However, in people who have experienced trauma, the brain thinks it's always in danger and is always exaggerating that danger. What thoughts pop into your head when you're experiencing your symptoms? Imagine that the symptoms have a mind of their own. What would it be telling you to make you take that action? After you've chosen your symptoms, you're going to want to write those physical sensations that you notice when you're experiencing the symptoms. Then you're going to write down the thoughts that go along with those physical sensations. And this is skill number 1, awareness. Just by having this much awareness about your symptoms, you've already developed a coping skill. Recognizing what is happening makes scary situations a lot less frightening. So, after you've written this stuff down, the next time those sensations or thoughts come up, you can recognize, oh, That's anxiety. That's going to help you a ton, and it's a skill within itself. In the next lesson, we're going to discuss coping skills. Thank you for choosing the Recovery Village. If you or a loved one are struggling with mental health or substance abuse and would like to find out more about the programs we offer, please reach out to us directly at 855-387-3291.